Hi, my name is Heidi. I will be doing the catheter insertion video for OC catheter insertion video. So I'm going to start by checking the MAR to look at the order, and that is the first med check. And I do see it's there. I'm going to gather my supplies, inspect the package, second med check. Okay, so I got my supplies. I'm going to knock on the patient room, introduce myself. Hi, I'm Heidi, I'm a nurse. I will be inserting a Foley catheter. Per your doctor's orders, is now a good time. So yes. So that's there. Put my supplies down. Do hand hygiene. Provide privacy. So this procedure is essentially just helping you use the bathroom a bit easier. It's emptying your bladder for you. You will feel the urge like you have to pee, but it will go away in a few hours to 2 weeks. Okay, so I would clean my work surface, raise it to a working level. At this point, it's a dining room table, so I cannot do that. I'm going to review for allergies. Looks like you have no allergies to latex, antiseptics, tape, so you're good to go. And can I also get your patient identifier? And their patient identifier is June 26, 91, and their name is Skylar Early. Okay, so I'm going to raise the bed, fix the handrails to where the patient is comfortable. This patient being a male right here, is gonna have his legs supine. And then I'm going to start the procedure. Start the process. So I'm gonna turn it this way. I am right here. I'm gonna don on clean gloves, not sterile, to get him all cleaned up. I would give the patient the supplies to perform this procedure, but in this instance, I will be doing it for them. So I'm going to start with washing the area and then throwing away the towel, and then I'm going to dry it. Okay. And I don't see any redness, swelling, lesions, or sores on the thingy, or on the penis. Okay, so that's done. I am going to now open up the catheter, or hand hygiene, open up the catheter kit. I'm going to step away from the patient, because that would be the patient. So I'm going to come over here, open up the catheter kit. Inspect it as I open it. It's good. Free. Okay. And this, go away. And then I am going to open away from me. And then I'm going to take the fenestrated drape, leaving the sterile field in viewpoint. I'm going to put this under my patient. I'm going to return to my kit, open it up, grab my gloves, and everything out. Touch the corners. Not let it fold in on itself, like I almost did. And then sterile field is in surface. I'm going to grab the drape. Sterile field is in view. I'm going to drape this over my patient. And then I am going to come back to my kits. And I'm going to open up my gloves. Make sure they won't pull in on me. I'm going to pick up the first glove. Goodness gracious. This went smoother during training and practice. Okay, gloves are on. Now I can work with my kit because I'm using my sterile gloves. I'm going to start by opening up my iodine swabs. Just throw away. And at this point, I would keep my hands above my waist to not get them unsterile. I'm going to place my iodine swabs back in the kit, open up my sterile lubricating gel, drop it in the trash, and then place the gel where it needs to go. Swabs. Then I'm going to move out my tray, place it within the sterile, hold my tray, pick up my tube, or grab my syringe, still in the sterile field, pop off the black, air bubble out. Whoops. Not it. And then I'm going to now take the green, set this back on top. I'm going to connect it to the catheter hook. So now, at this point, I can take my tray, and I'm going to wrap the cord around my fingers. We are going to come, take my tray, put it between the patient's legs, still in view. Syringe is right here. Grab the bag. I'm going to wrap this around like that. Syringe. And then now at this point, I have this around my dominant hand. I'm going to hold. I'm going to take off the plastic slowly and carefully as I do it, I'm going to wrap it around my sterile hand, so that way I can insert it. And I'm just going to throw this away, and then I'm going to lube it up, loop, 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 And then I'm going to take hold a grip on the base of the penis, insert. Tell the patient to bear down as I insert to make this process a little easier. Tell him he'll feel some pressure. And then when that is inserted, I'm going to now take my non-dominant hand, hold on to the tube, and insert 6 mils. 6 mils of water. And I'm going to let go of the, I think it goes to 10. Should. Or insert 8, my bad. That's how much is in the syringe. And I'm going to unhook the catheter, drop it. I will properly label the bag at this point for the facility standards. The sticker is right in here for the patient, Skylar Early, date of birth 6/26/91. And I would put it on the bag. And then now I'm going to clean up my mess here. So I can start by grabbing the supplies, uncovering the patient. Just gonna rip it down, throw it away. So clean up the patient, pick them up. And then clean up the patient, clean up the mess. And then I would throw all of this away. And then I am going to put on new gloves at this point, provide peri-cares, clean up the patient. New gloves at this point. I'm going to just clean up the extra lubricating jelly, and I did just rip off a paper towel. I'm going just to clean up the patient after the procedure, take hold of the base, educate them not to tug it, tap it, or tape it to the leg. And then I would give them modesty, get them back in their comfortable position, bed rails back up, cover them up. Hand hygiene. And I would have performed hand hygiene in between taking off gloves, the sterile gloves, and putting on the new gloves. And then I am going to leave this patient safe and comfortable, and I believe that is all. So, thank you.